Only 1.3% of the U.S. population has been tested. Now the Rockerfeller Foundation is releasing an ambitious new plan to test 30 million people a week at an estimated cost of $100 billion. The plan also calls for up to 300,000 paid testers and contact tracers and a common digital platform to track cases and resources. Joining me now are Rajiv Shah, President and CEO of the Rockerfeller Foundation and a former USAID administrator, and Dr. Kavita Patel, MSNBC medical contributor and former White House Health Policy Director. Welcome both. Raj, it's great to see you. Tell me about the plan. How is this going to be paid for? How do you see launching it?
Well, thank you, Andrea, for having me, and it's good to see you again. The reality is our country's been stuck at 1 million test cases per week for the last several weeks. We know that that's not enough to mount an effective effort to do surveillance in America as the economy starts to reopen. And we're very worried of potential resurgence of this COVID pandemic, especially through the summer and into the fall. So we pulled together experts from science, from industry, importantly, former government officials from Republican and Democratic administrations, and said, what's a specific, actionable, practical way to solve this problem? And we concluded that achieving a goal of getting to 3 million tests per week between now and 8 weeks from now, and then getting up to 30 million per week in 6 months is achievable with a set of concrete and specific investments and actions we can make. I just note that the Congress looks like it's passing a bill that includes $25 billion for testing, so 100 is not inconceivable in an environment where we're losing $300 to $400 billion a month in economic output, and in an environment where we've already committed many trillions of dollars to supporting the response in this economy.
Is the expense the testing as much as the contact tracing? Where do you see the budget for this really? Yeah,
the two go hand in hand. Sure, the two go hand in hand. We estimate that somewhere between $5 and $15 billion of the $100 billion is for deploying a workforce of up to 300,000 Americans in a community health core that would be accessible and allow for cities and states to scale up their public health workforce for this purpose. The rest of the resources is really for testing, for investing in new technologies, for procurement, and we've proposed a very specific effort to bring together the supply side, the demand side of the market, and do larger scale, longer term pooled procurement backed by financial guarantees, and ultimately to compensate all testing facilities in a similar manner, whether they are in network or out of network, for the actual cost of the test. It turns out that 2/3 of America's molecular testing capacity is sitting underutilized in university labs and research labs and small labs that are not part of the CDC diagnostic surveillance system. We can solve that problem, but it's going to take leadership at the state level and leadership at the federal level. One other point, Andrea, is that we're not just putting this out as a plan. We've committed $15 million to accelerating its implementation. We're already working with a dozen cities and some states and some Indian reservations, Native American reservations, to scale up this plan in specific parts of our country. So it's got to happen, and we all got to come together to make it happen if we're going to protect American families and allow them to go back to work.
Patel, do you see the national leadership coming together behind this?
I do, and thank goodness for people like Raj and the work that they're doing at the foundation. In terms of national leadership, Andrea, well, I certainly don't see it necessarily emanating from the White House, but I do think that nationally, between governors and mayors, and then even in kind of your coverage on the state of Georgia, you're going to have municipalities that are asking for this. I also think that what they're doing at Rockerfeller is critical to identifying the gaps. We've already seen in the United States that there are populations that have been overlooked, and they're consistently being overlooked. So we need, testing in and of itself is not the answer, even though we still don't have enough tests. We need to also make sure that access to that testing and access to healthcare professionals who can then do the contact tracing, as Raj described, that's critical. And then the kind of final piece of this is the isolation. And I mean having people who are positive be identified. What you covered earlier about cases that cropped up before Washington State, Andrea, I think that's just the tip of the iceberg. I think we're going to learn that was way earlier than anybody expected.
Scenarios for the future of technology and international development. I'm going to skip down. By the way, this report was produced by the Rockefeller Foundation and the Global Business Network in May of 2010. I'm going to skip down to page 18 and just read a few paragraphs and tell me if what we're seeing today isn't pretty much what they wanted all along. Page 18 starts, lockstep, a world of tighter top-down government control and more authoritarian leadership with limited innovation and growing citizen pushback. Remember, this was written in 2010. They write, in 2012, the pandemic that the world has been anticipating for years finally hit. Unlike 2009's H1N1, this new influenza strain originating from wild geese was extremely virulent and deadly. Even the most pandemic-prepared nations were quickly overwhelmed when the virus streaked around the world, infecting nearly 20% of the global population and killing 8 million in just 7 months. The majority of them healthy young adults. The pandemic also had a deadly effect on economies. International mobility of both people and goods screeched to a halt, debilitating industries like tourism and breaking global supply chains. Even locally, normally bustling shops and office buildings sat empty for months, devoid of both employees and customers. The pandemic blanketed the planet, though disproportionate numbers died in Africa, Southeast Asia, and Central America, where the virus spread like wildfire in the absence of official containment protocols. But even in developed countries, containment was a challenge. The United States' initial policy of strongly discouraging citizens from flying proved deadly in its leniency, accelerating the spread of the virus not just within the U.S., but across borders. However, a few countries did fare better, China in particular. Now remember, guys, this is just fiction. It's a projection written in 2010. They say the Chinese government's quick imposition and enforcement of mandatory quarantine for all citizens, as well as its instant near hermetic sealing off of all borders, saved millions of lives, stopping the spread of the virus from earlier than in other countries and enabling a swifter post-pandemic recovery. China's government was not the only one that took extreme measures to protect its citizens from risk and exposure. During the pandemic, national leaders around the world flexed their authority and imposed airtight rules and restrictions. From the mandatory wearing of face masks to body temperature checks at the entries to communal spaces like train stations and supermarkets, even after the pandemic faded, this more authoritarian control and oversight of citizens and their activities stuck and even intensified. In order to protect themselves from the spread of increasingly global problems, from pandemics to transnational terrorism to environmental crises and rising poverty, leaders around the world took a firmer grip on power. Friends, I cannot stress enough how important a document like this is. It's truly a smoking gun of what we've been warned by Aaron Russo and others is coming. It's part of their plan. We've known it forever. How were they going to get it? It turns out a pandemic is the perfect way to garner more unilateral, unchecked power. Back to the document. At first, the notion of a more controlled world gained wide acceptance and approval. Citizens willingly gave up some of their sovereignty and their privacy to more paternalistic states in exchange for greater safety and stability. Citizens were more tolerant and even eager for top-down direction and oversight, and national leaders had more latitude to impose order in the ways they saw fit. In developed countries, this heightened oversight took many forms. Biometric IDs for all citizens, for example, and tighter regulation of key industries whose stability was deemed vital to national interests. In many developed countries, enforced cooperation with a suite of new regulations and agreements slowly but steadily restored both order and, importantly, economic growth. So again, let's just review what's happened so far. A virus has been released, whether by accident or on purpose. You decide. Many have pointed to evidence that it is a bioweaponized virus, so more deadly than it otherwise would be. Whether that's true or not, you decide. But the end game is more unilateral power, more unchecked power, and more control by the government, by the corporations. And I would note, more bailouts for the banks. Now again, friends, that was from the 2010 document from the Rockefeller Foundation.